in history, this is the time for health policy research. That the issue is so important. It's so important from the budget perspective, from the health and well-being of the country's perspective, and from the readiness and progress of making change, that these things don't come together all that often, and this is the time. And so it's never been more important for health services research to get its best work clearly explained to people, the broader community, but particularly people in positions to help make change happen.
I think one of the biggest issues is what can different countries learn from one another. Too often in the last couple of decades, we've only been looking at it within our own countries. Now, of course, it's not so easy to take successes from one country to another because the structures are very different. But increasingly, there's a lot of that going on, whether it's with Canada and Europe and Australia, and now the U.S. is actually getting involved in that.
That we have to do something about obesity, we have to do something about ignorance, about how to take care of yourself, how to manage your own problems, the environment. And so I think that it's reaching out beyond just health services and understanding that to really improve the health of the population, we have to do a lot more.
I think one of them is how do you actually change behavior? We talk a lot about the need for change, but we haven't really figured out in many ways how to actually get consumers and providers interested in making the kinds of changes that are going to be necessary for the future of healthcare.
I think certainly one of the most important things is cost and how we are going to address the rising healthcare cost issue while at the same time providing adequate care to everybody.
Well, I think we're really at a very exciting time in health policy and healthcare in America with the passage of the Affordable Care Act and the struggle that states are having to implement it in various ways. It creates amazing opportunities to study the choices that states and delivery systems and policymakers make in the implementation. So that combined with an explosion of new data coming in from electronic health records and other sources really create new ways of thinking about research and doing research.
I think the most immediate question on the horizon is examining the issue of implementation of the Affordable Care Act, and in particular looking at the impact of expansion of health insurance coverage on vulnerable populations, including children and adults with disabilities.
Okay, there are many questions in health services research with the implementation of the Affordable Care Act, but I think a special focus has to be put on the role of public health departments and community health in actually contributing to the health of the populations, since we know that what happens in the delivery system is only responsible for 10% of the health outcomes in the population.
Trying to discover a way to regulate technology and regulate the development of R&D such that it'll continue to yield high healthcare gains while at the same time finding a way to control costs is one of the most important questions I think we face.
The obvious answer to that is the implementation of the Affordable Care Act. I mean, the questions around whether or not the feasibility of full implementation in January 2014, the implications of that act, for example, on issues as important as disparities in healthcare, racial and ethnic disparities, socioeconomic disparities.
Well, we're engaged in a grand policy experiment. That's the Accountable Care Act. And the big research questions are basically how is this working on the ground with all of this complexity in benefit design, in exchanges, who's going to show up in those, who's going to enroll, what kind of plans are going to participate, what kind of benefit structure they're going to have.
Well, I think one of the most important unanswered questions is the issue of getting behavior change to take in practice. How do you take information and make sure that people act on it as opposed to just providing information? That's a next stage that people are not very good at doing.
And the other big topics are, do we really need primary care? If we run out of primary care physicians, who will actually then coordinate the rest of us and the other providers and the non-health or non-medically trained providers in that? So big thing about that.
If we could answer the question and the challenges around racial, ethnic, and socioeconomic disparities, it would not only improve the health and healthcare outcomes of all those who are disadvantaged, but it would raise the healthcare quality and access for the entire system.
The most important question is to try to communicate better to the American public of what's happening and what's going to happen to them, so that we can dismiss some of that misinformation that's out there.
I mean, I believe the most important question is how can we assure equitable and universal access to high quality health services for all Americans and more broadly all people.
I think this is a hard question to answer because there's many issues here, but I think looking at the implementation of the Affordable Care Act, since there are so many opportunities there for improving the healthcare system, is where I'd focus.
I wish we knew how we could reorganize the delivery system in reality so that it worked better for people.
Certainly one of the most exciting and topical policy questions right now is what will be the consequences of the Affordable Care Act as it's rolled out and in the long run. However, there are a lot of important health policy issues out there and no shortage of questions that need attention.
It's to try to figure out the balance between putting a lid on rising healthcare costs and not losing value in the health services that are provided. My own sense is that the answer to that question is going to be found in multiple strategies because there isn't one single bullet.
I think a big issue is how can we use the mobile revolution to improve patient care. Not just electronic health records, but patient engagement. I think there's huge potential there.
I think we also don't understand in many ways how to take the really big picture. After you understand that a small change in one place will work, or a small reform in another area will work, how do you take it to scale? How do you make it really work for both the whole system and also recognizing that one size is not going to fit all?
In some ways, the questions that health services research have always addressed are going to be the new questions. It's just going to be a different population, a different technology, a different organizational change, a different market kind of driven kind of a response. Those are the kinds of things that the field has always studied, and those are the ones that they're going to have to study in the future.
There are so many different competing providers, suppliers of data, insurers, so many actors, and patients obviously in this whole process. And making change is hard because there's always, you're balancing one thing off against the other. And so how to really do this, how to help people see a broader perspective, how do people see the trade-offs, see what's reasonable.
It's hard to pick what is the most important health services research question because unfortunately we still have so many to answer. There's still lots of questions about healthcare costs, value, access, and disparities and quality of care that we still need really important, good answers to. I think if I had to pick, one of the most important things we need to do as a field is to really focus on how to improve the system. We've described it really well, we've explained it, but now we have to improve it.
There's a lot of stuff that's reported in the press, and the public reads this and they think that it's all believable because it's, there's data and numbers that reported and it's in the New York Times or the Wall Street Journal, wherever. Having a critical eye when they read something in the paper would be about whether that's really true or not. Just like you should with anything that's on the internet, it would be something that would be worthwhile for people to know that all researchers at Academy Health know.
I think one of the issues that's come up recently that I think is pretty common knowledge is this notion of hospital pricing and how hospitals' prices are set and how they don't really reflect the actual payments that are made by payers. I think that's something that we've long known about, but it has suddenly come to light in the media. And so I think it's a nice way to reintroduce this issue and kind of re-educate the public about what it's about.
Very often people think of researchers as being much more distal to the actual impact. And we who are scholars and activists believe that you can have impact and still do research.
Well, I think one of the well-known facts that we know as a research community is that the care system in this country does not deliver the quality of care that it could. That, we often quote Beth McGlynn's seminal study of 55%, Americans get 55% of recommended care. Most Americans think they get good quality of care, and so that's a really poorly understood fact, and I think it contributes to why we as a field have a hard time explaining why this type of research is so critical, because we can't improve unless we understand what works, what doesn't, and how to change.
The public thinks that any cost containment is rationing of needed services, and yet we all know that there's such a variation in what gets spent for what illness and on what patients that we could trim an awful lot and still keep excellent value.
I think about what is commonly understood by most economists is looking at the role of prices and people responding, and looking at the difference between demand and need for care, and that there are different policies to solve those different problems. And if you talk to any economists here, they will tell you that we totally understand the role of price and the fact that people should pay more for some services than they do and less for some services than they do. And most of the public doesn't really understand that.
I think one of the things that a lot of people don't understand is the role that evidence plays in good health care. I think all researchers here understand that and are really working towards making that apparent to the public. But the public is still very resistant. They hear guidelines, they think cookbook medicine and my doctor being controlled by a system.
As everyone debates the politics of health reform, I think what's really important that people know is that there's really solid research that health insurance makes a difference to people's lives.
Almost everyone in health economics, from the left to the right, agrees that there's a big problem with the tax deduction of health insurance. And almost everyone who's not one of us who are to listen to that would wonder what kind of idiot wants to tax my health care benefits. That sounds evil. While it's a good idea to help subsidize people's benefits and using the tax code makes sense, this is a problem. The current way we do this encourages rapid expenditure rises, really big increases in medical costs, and it's actually regressive. It's transferring money from relatively poor people to relatively affluent people, the way the tax code is set up.
I would say the thing that policymakers don't think about, that my colleagues here at AcademyHealth and at Mathematica think about, is the importance of understanding the special needs of working age adults with disabilities that have been historically locked out of the private health insurance market, and from the job market as well in a lot of cases. So we're giving up on a substantial part of the working age population and condemning them to a life of disability benefits and publicly subsidized health insurance. And they could be working, and they should be working, and they want to be working.
I think there are many issues that are not known to the public. I really basically think how payment mechanisms work between what insurers pay for and then what people on the ground get paid. All of the administrative and business kind of rules that are in the middle that take up some of that payment are unknown. I definitely know that the public does not really understand how the role of public health departments really would work in population health. Frankly, there's a lot of health services researchers who really are not knowledgeable about that as well.
When I tell somebody I'm an economist working within health services research, the scariest thing is their lack of understanding that I'm not talking about cost effectiveness. Cost effectiveness is still effectiveness. It may bring cost into it, but it's not understanding the determinants of the costs that are being used in that analysis. And that's what most of the economics is about, is understanding the role of resources in healthcare.
Research is a lot less certain than people might think it is. Conclusions change. You get new information, new things happen, and it's not always easy to figure out exactly what the right answer is. So you start with the right answer, there's an iterative process, you refine it. But people don't like that. They want to have certainty.
Well, definitely they should take a look at the wide range of stuff that Mathematica staff have been working on. So it's rigorous research. It's written up in a way that's very accessible, and it's all on hot policy issues.